All right, when you're ready.
Welcome back to the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Kolender, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms and downtown Detroit. Dr. Kolender is here with us discussing his concierge practice and how to avoid heart attack and stroke, and how to begin the reversal of artery disease. Now, Dr. Kolender, the last segment we were talking a lot about diabetes, who gets it, and we left off discussing insulin and insulin resistance. And what is insulin?
So Anne-Marie, insulin is one of the most important hormones in our body. Insulin is produced by your pancreas in response to food that you eat. So when you eat food, let's say food is broken down into fat and sugar in basic sense. Your body sees this fat and sugar in your bloodstream. Your pancreas recognizes, hey, there's fuel, there's energy in the body. It sends a signal to your muscles and organs to use the fuel that's in your blood because you just ate it. Now, if you are eating a lot of sugar and fat on a regular basis, you're requiring your pancreas to generate a lot of insulin all the time. And your muscles are being told, your muscles and organs are being told to take in this sugar and fat fuel all the time, but they might be full. They may already have all the stores that you need at that time. So what happens is your muscles and organs start down-regulating insulin receptors. And again, I'm giving you a simple version of this, but this is a basic idea. Your muscles and organs start down-regulating insulin receptors and they stop listening. So when your pancreas is sending a signal by putting out insulin to your body to use the fuel that you've just eaten, and your muscles and organs are not listening, that's called insulin resistance. So what happens, your pancreas says, there's still too much fuel, I'm gonna pump out more insulin until it overcomes the shortage of receptors, and then you start using them. Over time, your pancreas gets tired out and stops being able to make enough insulin, and you become pre-diabetic and diabetic. Now let's talk about diabetes. We talked about insulin. We talked about the concept of what insulin resistance is. Now let's talk about diabetes. I'm going to describe it as an arbitrary term used to say, when are we diagnosing you with this condition where your pancreas isn't active enough and you need help? You need drugs to supplement or help your body manage this extra sugar in your bloodstream. Why is that important? Why do we need to manage this extra stuff in your body? Because having too much insulin and sugar in your body, which means you're insulin resistant, is an environment that causes heart attacks and strokes and Alzheimer's and cancer and dementia. So we want to fix this environment. We want to make this environment of insulin resistance go away. So what's scary to me, and should be scary to all of you out there, is that if you have a family history of diabetes, if you've been told you're pre-diabetic, if you're diabetic even, you have insulin resistance and it's probably not being managed. I want to tell a story about one of my patients, and I'm not giving a name, of course, but he was seeing his endocrinologist. Of course, he had diabetes. He was seeing his endocrinologist, he's seeing his heart doctor, and his endocrinologist is telling him he's a poster boy for his practice. He's doing everything right. He's very happy with how he's taking care of his diabetes. He goes to his heart doctor, he gets a pat on the back, you're doing great. Now he comes to me, and I'm doing blood work that measures inflammation, and I'm not happy at all with anything that's going on. Now, Kay wants to know, what's the connection now between this inflammation and insulin resistance? And here's the connection. The connection is insulin resistance is one of the many drivers of inflammation that causes our arteries to be angry. And when our arteries are angry, you get ruptured plaque. The ruptured plaque causes a clot to be formed because your body wants to heal that rupture, and you have a heart attack or a stroke because that event is happening. So we need to manage insulin resistance. So going back to my patient, here's a guy, he's diabetic, and he's being told by his A1C is good. Everyone says, know your A1C.
What's an A1C?
Hemoglobin A1C is a blood test that's used to manage diabetics. So hemoglobin A1C is a measurement of sugar that's being collected on your red blood cells. So as your red blood cells are floating through your body, and remember, you have insulin resistance because you're diabetic, which means you have an environment of high insulin, high sugar. That means there's high sugar in your blood, so your red cells are collecting all this sugar on it. There's a blood test that measures it, and the higher the number, the worse controlled your diabetes is. So here's a guy who had a good enough A1C that his endocrinologist was very happy with him, yet his insulin resistance was not being managed. That means the driver of inflammation was still unchecked, and he ended up needing a heart bypass. And again, it's because I moved his workup along quicker because I noticed things were going on. Now you may say...
Okay, wait, I gotta ask a question here. So this patient that we're talking about was already under the care of a cardiologist and also under the care of a specialist endocrinologist. How did this factor get skipped over? How did it not get, why did they not have control over this inflammation factor that we talk about?
It's back to our broken health system.
Okay.
We're back to that. Our health system, again, is using formulas that are meant to apply to everybody that don't apply to anybody. You have to personalize your care. Again, back to why you got to see me. You need to see a doctor who has the wherewithal to identify your risk, who's working a little, you got to be outside the system because a lot of these blood tests are not covered. So in our practice...
What do you mean by they're not covered?
Insurance is not paying for prevention. Insurance is paying for treatment of end-stage disease. They'll pay for a heart cath, they'll pay for the bypass, but they're not going to pay for simple testing that identifies risk so we can prevent disease. So within my practice, there's a small fee for joining my concierge practice, and the fee includes some of the testing that we do to help identify your risk. And you might be listening, and I'm going to say you should be thinking, Dr. Kolender, why did your patient have a bypass? He's in your practice. And I'm going to say...
Well, I thought he circled back to you. He was originally your patient,
well,
right?
I'm just still giving people, the
Right.
naysayers out there, a chance.
Right.
I hear you talking.
Right.
The answer is, I'm learning as I go. I know more now than I did then, and we're applying better principles to my practice. This happened a few years ago. I know a lot more now than I did then, and we're advancing. I still recognize he had an issue, and also people that are in my practice, just because they're in my practice doesn't mean they're doing all the things I ask them to do. We're all human, and we all are not perfect, and unfortunately, he might have been one of them, but what we need to do is identify who has insulin resistance back to our big picture, because insulin resistance drives vascular inflammation. Vascular inflammation causes blood clots to develop, which kill us, or cause strokes, which disable us. So we need to do, that's our goal.
The other thing is too also about, you mentioned something about the tests being covered by insurance. Are you doing tests that they can't get done other places?
We're doing tests that you can't get done in other places. We're doing blood work that manages and measures inflammation. We're doing simple imaging tests, which we'll talk about next segment, that helps us identify vascular inflammation.
Okay, well, we're gonna have to take a quick break. In the meantime, you're listening to the Kolender Medical Radio Show. You can reach Dr. Brian Kolender by calling 248-737-0091. Again, that number is 248-737-0091. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR. That's really short.